more complex health needs is straining the system, and some families are still grappling with the consequences of not having the adequate supports in place. When his mother was diagnosed with terminal lung cancer, Craig Lindsay felt like he had no one to turn to for help.
When someone is dying, you just want to comfort them. You don't want to worry about making an endless series of phone calls and trying to find the person to get the answer. You just want to be there for them.
He was left on his own to care for his dying mother, who wanted to live out the last of her life at home.
We were challenged making my mother comfortable and safe at home. There were very little supports in place, very few visits from a palliative care team or a palliative care physician.
A caregiver left in distress thanks to a lack of psychological and social supports he felt should be a part of a high-quality palliative care system. A new report shows only 1 in 4 people living the last 30 days of their life at home received a home visit from a doctor, a number up from 5 years ago, but still not good enough.
If 1 in 4 people get a visit from a palliative care doctor, 3 in 4 don't, and that makes life and their death difficult.
The report also found an increased percentage of hospital beds are being used for people who are waiting for care elsewhere. More than 1 in every 7 days that patients were in Ontario hospitals were spent waiting to go to a place like a long-term care home or a rehabilitation facility. Emergency department visits are on the rise, especially for those with serious conditions. Patients are spending an average of nearly 16 hours in emergency departments before being admitted to the hospital, and fewer people are seeing a specialist within 30 days.
These are not new challenges we're seeing, but we're seeing the pressure building.
The aging population contributing to the backlog.
Their needs are more complex and their conditions are more chronic, and so that means that their need for healthcare services also increases.
The opioid crisis also playing its part. Disturbing statistics show hospitalizations and deaths are on the rise, adding pressure to a system already stretched to its capacity. Coming up, solutions to these problems, plus the report also highlights some improvements to the healthcare system. We will have that for you later in the show. Earlier in the show, we told you about a new report that highlights some strains on Ontario's healthcare system. Hospital wait times are up. More people are waiting in emergency room departments before being admitted to the hospital, and fewer patients are seeing specialists within 30 days. The report by Health Quality Ontario also highlights some improvements. People in Ontario are living longer and are less likely to die before the age of 75. More people are having cancer surgery or general surgery within the recommended wait times. Rates of the hospital-acquired life-threatening infection C. difficile has continued to decline. Fewer children are having their first care for a mental health condition occur in the emergency department. And officials say these improvements prove that focused efforts to improve the healthcare system are working.
The good news is that there is a real commitment right now to focus on this issue of hallway healthcare. We've seen a Premier's Council established to tackle this really hard problem. It's not going to be easy. There's no single solution, but it's a good opportunity with the front line focused on this, with the Premier's Council focused on this, and with many system leaders focused on this issue that I do have some hope that we're going to be able to tackle this.
We've uploaded the entire report by Health Quality Ontario on our website. You can check it out on citynews.ca.